Good evening, doctors. Welcome again. Today we are going to discuss here about Neet PG test series. This is first, and I already explained if you score at least 70% marks in this test series, that means you are going to score a rank below 3000, and if you are going to score 50%, that means you are going to clear the exam, and below 50 means doubt. So guys, first question in front of you: which of the following is a traction epiphysis? Answer I am going to provide here. Pause this video, take pen and pencil and see which one is your answer. So the best answer here is, try to take pen and pencil and mark one is right, two is right, how much is right. So answer here is mastoid process is an example of traction epiphysis. Let's discuss all epiphysis. In pressure, epiphysis is head of femur, head of humerus, lower end of radius, and traction is greater and lesser trochanter of femur, mastoid process, etc. Atavistic is coracoid process, whereas aberrant is the first metacarpal base of metacarpals. Hope it's clear. Now, which dietary fibers have least water solubility? So, pause this video and try to answer this question in your copy, and then see is it right or wrong. So, least is hemicellulose. Answer is hemicellulose. Okay. Premature ejaculation occurs in which phase of sexual cycle? Same funda, try to answer in your copy, and if it is right, take right there. And finally you have to calculate how much percent you are going to score. So answer here is orgasmic phase. Let's discuss individual about all phases. In excitement phases, phase increase in BP, heart rate. When you see a girl, beautiful girl in front of you, then increase blood pressure, heart rate increase. Erection of penis male, swelling of clitoris in female, because these both opposite sex attract towards each other. So this is a physiological phenomena. In female there is clitoris and labia minora. Vaginal lubrication occurs in excitement phase. What happens in play 2 phase? This excitement occurs more. For example, more increase in BP and heart rate further. And what is orgasm phase? When reflexive pelvic muscle contraction occurs. This is shorted phase, and here premature ejaculation occurs. And what is resolution phase? When your body is cool, calm, and body returns to pre-arousal state, means in normal state. So premature ejaculation occurs in orgasm phase. Hope it's clear. Now, why is CPD stored blood better than ACD stored blood for transfusion in a hypoxia patient? Also pause this video. Try to mark answer in your copy A, B, C, D. If is it right, put right. If is it wrong, put wrong. And finally you have to calculate how much you are going to score here. So answer is fall into 3 DPG is less. So this table in front of you, read by your own, guys. Now, cetuximab is used to treat this cetuximab C, responsible for the treatment of same funda. Pause this video, take 30 seconds. So answer here is colorectal carcinoma. Now, E. coli infection occurs in which enzyme defect? This infection mainly occurs in defect of, you have to pause the video, guys, and try to answer in your copy. So answer is pyruvate kinase. Now, the most widely used dependence causing substance is, so most widely used dependence causing substance is cocaine, cannabis, amphetamine, heroin. Which one? Answer is cannabis. If alcohol in option, then go for alcohol. Okay, let's discuss. Alcohol is the most common psychoactive substance in India. So 75 year of age, 14.6, and alcohol, after that cannabis, then opiates are the next. Okay, hyperextension of MCP joint and flexion of IP joint occurs due to involvement of which muscles? Try to answer this question in your copy. Which answer is right? Pause this video. Best answer is lumbricalis interossei. Okay. Now, all except one is true for scleromalacia perforans. It is non-inflammatory scleritis. Affect only males. So which one is the best answer here? Guys, the best answer is it affect only male. It's wrong. It mainly affects female. It is non-inflammatory scleritis, absolutely right. Perforation of the globe is extremely rare. Vision is unaffected. Now, hoarseness, virilization of female voice, secondary to exposure to androgen, can be surgically treated by. So, the best answer here is thyroplasty type 4. Let's discuss what is thyroplasty. In type 1, there is medial displacement of vocal cord done by injection gel form Teflon paste. Type 2, lateral displacement of cord done improve the airway. In type 3, what happens? Transformation from female to male, lower the pitch. Okay, female to male. And in type 4, lengthening, tightening of cord, elevate pitch, gender from male to female. Okay. Which vaccine is contraindicated in pregnancy, guys? This is very high yield MCQ. So many examination, lot of time they like to ask. This is a favorite question of exam. So remember, all live vaccine is contraindicated in pregnancy. Okay, live vaccine is contraindicated. So how to remember killed and live vaccine? Remember killed vaccine. Killed vaccine, I give a mnemonic. जापान की खीर. Remember Japan, Japan, Japan. So Japanese encephalitis. K means killed polio vaccine. I means influenza vaccine. And kheer, KHIR. K for KFD, H for hepatitis B in option. So killed is not contraindicated. Hepatitis B, R for rabies. Okay, and you have to memorize tetanus toxoid. So remaining here vaccine is chicken pox. So answer here is chicken pox. Okay. Now, all of the following are features of Rett syndrome except. In Rett syndrome, we see what? Except they are asking. So ready your pen pencil, try to write answer in your copy. So in Rett syndrome we see microcephaly, regression of milestones, cardiac arrhythmias but no focal convulsions. We see there is generalized convulsion or diffuse, we can say. So Rett syndrome is age of onset 5 months. Development may proceed normally till 1 year of age. Regression of language and motor milestone became apparent. Acquired microcephaly. Most children develop peculiar singing, respirations with intermittent periods of apnea. Autistic behavior is typical finding in all patients. Generalized tonic-clonic convulsion, not focal. Feeding disorder and poor weight gain are common. Cardiac arrhythmias were here. Okay. 25-year-old man complains of recurrent abdominal pain, but biochemical assays and ultrasound abdomen is normal. He also complains of constant headache. He suddenly complains of loss of vision in bilateral eyes. Ophthalmologists find nothing on examination. Symptoms are most probably due to. So, this is a case of factitious disorder. Factitious. It is also known as hospital addiction, hospital hops, professional patient, patient who repeatedly stimulate or fake disease, unintentional. Okay, characterized by restless journey, etc., etc. Okay, all are true about stereotactic radiosurgery except X-rays are used, a form of radiotherapy used in AV malformation. Damage to nearby structure is significant. So the best answer here is damage to nearby structure is significant. This is the answer. Except they are asking, that's why. Which of the following is the most common method used to know the depth of anesthesia? That is BIS. 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 Okay. What is bispectral index? Is a statistically based empirical derived complex parameter. It is weighted some several electroencephalographic subparameters EEG. BIS is a common method used to know the depth of anesthesia. So let's discuss. 80 to 100 patient is awake, 60 to 80 moderate sedation, 40 to 60 general anesthesia, we can say no awareness, less than 40 is deep anesthesia, less than 40 deep, 40 to 60 general anesthesia, 60 to 80 moderate sedation, 80 to 100 awake. You have to remember, a patient presented with multiple superficial oral ulcers that are recurrent. On examination, genital ulcers also present. What is diagnosis? So this is a case of Behçet's disease. This one is a case of Behçet's disease. Okay. If fetus is having hypoxia, which of the BPP parameter will be affected last? Fetal tone, fetal breathing movement, fetal movements, NST. The best answer here is fetal tone. Answer is fetal tone. Okay, what kind of note is it? What type of note is it? So this note is, what type of note is it? This is granny note. Granny note. Okay, let's discuss all notes. This one is surgeon's note. This one is square note. This is simple note. This is granny note. Okay, and this one is half hitch. Half hitch. For prophylaxis of meningococcal meningitis, drug used is, in prophylaxis of meningococcal meningitis, you know the drug of choice in meningococcal meningitis is ceftriaxone, but prophylaxis we need to go for rifampicin. Rifampicin is used as prophylaxis. Costal cartilage of ear. Okay guys, in this okay, I can add one more MCQ, no problem. Costal cartilage of 8th and 9th rib articulate with each other by which type of joint? So answer here is synovial joint. So you have to memorize this table. Intervertebral disc symphysis. Symphysis. Costovertebral joint of head of rib or costotransfer is synovial or gliding joint. Costochondral synchondrosis. Costochondral synchondrosis. Interchondral synovial. Sternocostal, first is synchondrosis, 2 to 7 is synovial. Sternoclavicular saddle type synovial. Manubrosternal symphysis. Xiphoesternal synchondrosis. So guys, I hope till here it's very much clear for you. And don't forget to write your score, how much you score in this quiz, or we can say in test series. If you like this video and if I see lot of likes here, so I'm going to make another video also, second test series also. Thank you for watching this video. Goodbye.